Hello, this is Dr. Lewerenz at Longevity Health Institute, and I hope this finds you well, and I hope this educates you, but also you share this with your loved ones, especially your parents, your uncles, your aunts, your relatives, your grandparents maybe, because this topic is very specific about, let's say, postmenopausal or what we call post-andropausal, men with andropause, which is the male hormone decline. But there's some significance in addressing hormones, any hormone, because you hear me talk about this before here. Me and my practitioners are wonderful at addressing these issues, and these issues that are very, very, very common, but often overlooked, especially if you're 60, 65, 70, etc. So the first thing we always do is do no harm. The first thing, and educate you and take a personalized approach. But hormones are very, very, very delicate, very strong, and very important in your overall wellness and well-being. In things with aging in the older or elderly population, once you're in your late 60s, 70s, and 80s, some of the biggest risks are bone loss, cognitive decline, cardiovascular events, okay, and risks of falling. And something that happens all the time when we age. And even if we fight against that, and here at Longevity Health Institute, we always look at aging as a disease. But the thing that we track all the time is things that reduce your mortality, overall mortality, okay? But one of the big things that when you age, this happens, okay, is that you get sarcopenic, which is mass losing. So you have to protect muscle, you have to protect bone, you have to stay active, and why it's so important not just to work on your cardiovascular health and building strength and muscle and that, but also staying very, very, very supported on that level that supports bone health and muscle health, okay? Very hard to do if you're not addressing hormones, and particularly your sex hormones, but any hormone. So here we always take a personalized, balanced approach, and we look at your thyroid, your insulin, your sex hormones, including testosterone, estrogen, progesterone, growth hormone, DHEA, and yes, all of your adrenal hormones, including cortisol, and yes, DHEA. Pregnenolone is important, but the big ones that often get overlooked once you're, let's just say, retirement age, 60s, 70s, 80s, which you can be very active and very healthy and very independent. But what happens very slowly, and I had someone today that was here that the kids, the husband and wife, see me, and they sent their parents in. Their parents were both mid 70s, very independent, very, very, very mentally fit, cardiovascular wise fit, but one of them had osteoporosis, one had osteopenia. When we talked about their weight, they've got what we call skinny fat, so we lose mass, muscle, and bone, we gain a little belly fat, and yes, they're staying cardiovascular active, walking, etc., but they are losing mass. And anytime we lose mass and we get into this structural issue, okay, your risks of falling and breaking a hip or a spine, and then complications and death go up to 20 to 30% in the hospital if you fracture your pelvis, hip, or spine as you age. Too many things happen, too many complications happen when these things occur. So you want to maintain muscle integrity, you want to maintain bone integrity, you want to maintain fitness, okay, as well as cardiovascular health. But you can't really do that, and it's very hard to do if you don't have those hormones that are the building blocks in a balanced, appropriate way to support that structure, that regeneration, okay? So here at Longevity Health Institute, our personalized functional approach is looking at you regardless of age. Now, of course, everything's personalized. We look at you and want to make sure, again, we're doing no harm and that you have no risks that could hinder or preclude us from doing hormone replacement. But it's so important to at least have that discussion, to appreciate that with your provider, your practitioner, okay? And don't believe the negative hype about past experiences and past studies and past history. that talk about hormones as a negative thing. Yes, of course, synthetic hormones, synthetic horse urine estrogen, of course, inappropriate dosing of testosterone given to the wrong person at the wrong place and time, of course, just like any form of medicine, is going to be bad. But hormone replacement done appropriately in a balanced, personalized way to physiologic levels, not super physiologic levels, maintain your structure and can keep you well and thriving and not just surviving, as I say, but literally living optimally. Now, the patient that came in was on a follow-up, and what's interesting is she was in her mid to late 70s, and again, living very independent and doing very well. But part of her thing that was giving her a little bit of trouble was back pain, inflammation, weakened bones, not being able to do as much as she could or recover as well. That was frustrating her, and she had had previous falls, fortunately not breaking something, but now we got her physical therapy, we got her occupational therapy, but we actually instituted a program with her that was part of a hormone replacement program, done naturally, done balanced, okay, tested and retested so that we know it's right for her, and she's absorbing it, metabolizing it, what we call methylating or detoxifying it, eliminating it, but that these were done balanced, that her goals were met, but that these pieces were in place so that she could build muscle and bone and maintain that. The other wonderful thing that I always notice and see in patients that are like this and fit that is part of the thing that happens in our brain is we get cognitive decline. As we age, our brains actually atrophy and shrink. And we don't want to ever get an atrophied or a shrinking brain. Now, I know that sounds funny, not comically funny, but really our brains shrink. When they do scans on individuals, okay, whether they're SPECT or MRI or CTs with an aging person, we see atrophy of the brain. We see mass of the brain. And that is, a lot of it is very has to do with hormones in blood flow and brain volume, which obviously if your brain is shrinking and you have less white matter and gray matter, you're going to have less cognitive ability, okay? And you have to be very preventative and proactive with brain and memory and brain health, okay, than reactive and, oh, I can't remember this, or where I put my checkbook, or what I do with the keys, or I can't remember that code, or I forget to take my medications, etc. Okay, we have to be preventative and proactive on memory always, and we even start here at Longevity. We even start here in your 50s. So this is Dr. Lewerenz. Please share this with your aging relatives, parents, aunts, uncles, grandparents. Get them into a practitioner like a functional medicine doctor, provider like ourselves. Okay, we are here in southeastern Michigan and always taking new patients and building a practice to serve you well. But don't negate your hormones, particularly your sex hormones. Hormones are very important to be balanced and done appropriately for aging, longevity, and prevention. This is Dr. Lewerenz. Be well.